Well, an issue in Ghana is that the comprehensive operational system was something that we've really take for granted in the U.S. and Europe. That's not a common concept here. It gets broken into pieces. And there are many components to this, some of which you can't fix right away. You know, having adequate healthcare insurance, for example. But the concept of making functional systems, I think, is really a big contribution that the Breast Health Global Initiative and Hope Exchange are bringing to Ghana.
And how does this impact the rest of sub-Saharan Africa and even the rest of the developing world?
Well, the models that we're developing these are pilot programs, the goal of which is to sort out here, how does this work? And then through this implementation science, that is the study of how you implement, which is the third component of the learning laboratory. We study what worked, what didn't work, and how can we incrementally improve, actually measure outcome. That is something, what we're doing here in Ghana, our next step will be multi-country, and where we're going to do some special training and bring in, I'm anticipating doctors from other surrounding sub-Saharan African countries.
How has this changed the way you practice back in the United States?
Well, for one, it makes me profoundly appreciative of how fortunate we are in the U.S. We just don't realize how lucky we are until you go somewhere and see what they don't have. As an example, as a surgeon, we get pathology reports. And one of the basic level resources that we learned about when we came here in 2004 is you have to have high quality pathology reports in a reasonable period of time. At that time, a pathology report would take 4 to 6 months to generate. And how can you treat a cancer if you can't prove it's cancer for 4 to 6 months? So when I used to complain about my report taking a week, I think a week's not so bad.
Why is it this new hospital that Hope Exchange is building for this effort?
I think Hope Exchange has a tremendous opportunity to create something special in Ghana. An issue, and this isn't different from the U.S., we all get locked into our systems. But I think that Hope Exchange will be a complementary facility. Their focus is going to be on specialty education. So it's like the old give a man a fish, feed him for a meal, teach a man to fish, feed him for a lifetime. And that really is the philosophy of Hope Exchange. What we need to do is improve capacity. So we're not here to fix breast cancer for Ghana. That's not realistic. What we want to do is give people in Ghana the tools so that they can fix it themselves. And that is a core value of Hope Exchange.
And do the people of Ghana want these tools? What are you finding from the people you meet? Are they ready for it?
I have to tell you, I'm really crazy about the Ghanaian people, and I admire them tremendously. And there's a culture here that's really well suited for this. They're positive, they're optimistic, they're cheerful. You look and you think, gosh, the resources are so limited in comparison to the wealth we have, and yet the people really are so upbeat. And they work hard, and they want to make it better. Just today, when I was watching Dr. Jay Harness teach how to do an ultrasound-guided biopsy in the breast, and these Ghanaian surgeons were crowded around and watching, and they were observant. They're plenty smart, and they were trying to figure out, how do I do that? And that's what you need. It's heck, when you teach a class, you want good students. The best students are here in Ghana.
I understand that you have a student with you right now from
University of Washington. Yes, so Ibrahim Ali, and he goes by Ali, he was a gift from God. I gave a talk on the work that we were doing in Ghana back in Seattle, and this young guy comes up and says, I'm a social work student here, and I'm from Ghana, can I work with you? And to make a long story short, he has been absolutely invaluable in helping us organize this. Something that I've come to learn, you can come in from the outside, but you don't really understand someone else's culture any more than someone coming to the U.S. immediately understands how we work. And so you need to have people from the culture working with you that also understand your culture so that you don't make blunders, so that you communicate well, so that you don't offend people, and so that don't seem like it's entirely making sense. They can help you understand what was going on because the rules are different.
So, if someone wanted to Hope Exchange, what could they expect to see as a return on this?
I believe that Hope Exchange and the Health Global Initiative have the opportunity, the potential, and I believe the future to change healthcare around the world, developing these models that will apply. You know, the World Health Organization in the 90s had basically written off Africa for HIV. They said, we can't afford it, it's not possible. And there were a group of doctors and scientists and nurse care providers that didn't buy it. And HIV has been dramatically changed in Africa, really proved that it is possible, that we can lift ourselves by our bootstraps. And that's what this is all about. This absolutely is doable. And I believe that Hope Exchange and the Breast Health Global Initiative, that's the potential we have. I think we're on our way.
Anything else?
My pleasure.